My name is Dr. Olivia Hutchinson. Over the course of the past 20 years in private practice, I've seen a very broad spectrum of issues other plastic surgeons are unfamiliar with or may not be comfortable addressing. One of the things that I feel very confident about is knowing that I've taken care of myriad types of patients who've had any number of complaints and any number of problems, and that we've been able to help them regardless of how complicated the situation was. I try to make sure that everything that we do is done at the very highest level, and that's across the board, whether it's safety for the patient, whether it's aesthetic results, whether it's the environment and the services that we provide from the moment that a patient walks in the door, always trying to anticipate needs and exceed expectations so that the patient's experience is really better than they could possibly have imagined. There weren't that many women who were plastic surgeons when I started out. I went to Harvard for my undergraduate studies. I then went to Columbia for medical school, and then I did my residency training in general and plastic surgery at Columbia Presbyterian. I think that my standards are probably higher than other people's. I myself am a mother, and patients who've been through pregnancy and who've thought about some of the changes that happen to their bodies afterwards, I can certainly identify with that, having had children myself. The patients that we see really want to be better versions of themselves. They want to look natural. We're trying to improve upon what they already have. And I think that surgical technique is also extremely important. How the tissues are handled and the types of sutures and all of the judgment that needs to be incorporated into the decision-making process. No matter what type of scenario we're going to be faced with during the operation, they're in good hands and they'll be able to have a good result. Staff are beyond wonderful. All the nurses who work with us are fully certified. They are designated operating room nurses. They do cosmetic and plastic surgery day in, day out. Our anesthesiologist is a board certified anesthesiologist, and our facility is a Quad A fully certified operating center. So we don't cut corners. We hold ourselves to the highest standards above what's demanded by the industry or by external organizations. And that just gives us a comfort level in terms of knowing that we provide the very best for our patients.